everyone. Happy afternoon, a very good afternoon. Before I even start saying anything, am I audible and visible to all of you? Okay, so that's great. So I see I am visible, and you guys can also give me a nod that yes, it is audible as well. So guys, in this session we are going to do INICET recall of ObGY. Actually, we were supposed to do it in the today's 5 p.m. session, but then when I was going through the INICET recall questions, the very important topic which is very frequently asked in your exam is partograph, right? And again, partograph, like your suture materials, which we simplified yesterday with mnemonics. I hope all of you remember the mnemonics for suture materials. वो topic simplify हो गया. So today 5 p.m. we are actually going to discuss partograph. I'll simplify the topic of partograph in today's 5 p.m. session on the Unacademy app. It's a free live class. So all of you can join. For those who are new here, you can download the Unacademy app, and when you come for the class, if asked for a password or a code, you can use the code Dr.Nikita to join in. तो आज 5 बजे है आपका पार्टोग्राफ and 10 p.m. YouTube live session on Unacademy channel, and that is again very important and a very frequently repeated topic. That is your hepatitis B serology. Okay, that is your hepatitis B serology. So this is the plan. It's gonna be a very high yield day today, high yield sessions today. And for those, if all of you are up here after the yesterday's session, so how many of you had been witness to this yesterday? So actually this is something which we did for the first time yesterday, and this is the study with me session that we did yesterday. It actually started yesterday at 12:30 a.m. probably, and so we had this study with me session. That was episode 1 yesterday, and you can see how sincerely I am studying. So all the learners here who were there yesterday, I hope you benefited out of this, and this is something that I am planning to do on a daily basis or a very frequent basis. Whenever I am studying, basically late night, I will come live and I'll make all of you study as well. So yes, so today also we will do it. तो आज रहेगा midnight, basically 12 बजे start करेंगे. As I've told you that I've always been a night owl. I work late nights because when everybody else is sleeping, you get that peace of mind. आराम से काम हो सकता है. So 12 a.m. is when we would be starting. Yesterday also, actually, you won't believe, for those who were not there, we studied till 2:30 a.m. yesterday. I mean, that was a huge time. 2:30 a.m. 40 minutes के 2 sessions हमने किए थे. So 80 minutes is what we had studied yesterday, and it was, let me tell you, it was very productive. At least for me, I felt like I was back to the days when I was preparing for my PG entrance exam. So it was actually like that. So बड़ा मजा आया. So this is what we are going to continue. और 12 बजे रहेगा आज. देखते हैं 12 to 1 तो रहने वाला है. 1 सेशन 60 मिनट्स का करेंगे और फिर ब्रेक लेंगे. देखते हैं कितने बजे तक होता है. ठीक है. So this is basically for the night owls. So Manisha, and because as I told you कि I have to wait for everybody else, for my daughter and everyone else to sleep, and that is why we will be having this sessions late night. So midnight रहेंगे mostly. उसके पहले it's a bit difficult. Okay. So 12 बजे करेंगे. Parnika is over ambitious here. Parnika wants to do it 12 to 2. 12 to 1 तो कर ही रहे हैं Parnika. देखते हैं आज अगर और करना होगा तो और कर लेंगे. Let us see. So I'll see you all. The link will be shared on Telegram group. Okay, these are not going to be public sessions because the feedback that I received from you guys. So let's keep it like a closed session where actually the sincere medical PG students will join in for studying, and it's like a virtual library. Okay, virtual library which is there. All right. So मिथुन, वैसे तो बहुत सारे whatever we do is not right actually जो हम रोज करते हैं. There are many things we should not be doing, but we still do it. So let's go ahead with the today's session, guys. INICET recall 5 baje Partogram और 10 baje hepatitis B serology. All the sessions are very, very important. And then 12 a.m. midnight, we are going to have study with me. So this one here, the first question, I'm starting with a controversial topic. I know I'm putting my foot into it. So this INICET, unexpectedly we saw less number of questions in ObGY. Otherwise generally ObGY used to be a major chunk. इसमें 10-12 जितने question थे. But remember, no matter your ObGY is a very, very important topic for your any subject for your any exam. Yes, there was some issue. As I told you guys, there was some problem with Wi-Fi. तो बीच में थोड़ा सा problem आ गया. अभी is it fine now? Let me just give me a moment, guys. I am not able to see the video. 1 minute. Alright, so this is a question on your cord prolapse. So if a nurse witnesses the umbilical cord coming out of the vagina in a term pregnant woman, what is the most appropriate step that the nurse, I think the question actually mentioned midwife, should do? Okay, what should the midwife do? Gently push the cord back, ask the patient to lie in Trendelenburg, inform that the patient needs to be shifted for delivery immediately, or do a vaginal examination to know the presentation. So here, because the question is specifying it is midwife or nurse, that is why the answer is going to be your Trendelenburg position. What is your Trendelenburg position? It is basically your head low position. So the umbilical cord is coming out of the vagina. So basically there is cord prolapse. Cord prolapse हो रहा है. So we should not push the cord back, and even if we are handling the cord, it should be very, very minimal handling. Because when we touch the cord, it can lead to vasospasm. Vasospasm हुआ, fetus को blood supply कम हुआ, so that can be very dangerous. So do not touch the cord with bare hands. You need to wear the gloves or gauze piece लेके फिर आप minimally फिर push कर सकते हो. But उसके पहले, especially when it's a midwife or a nurse, the first thing to do is give head low position. So that with gravity, so when you give head low position with gravity, the cord will go up, and that is the first thing to be done. You can give Trendelenburg position, you can give knee chest position. These are the positions that can be given. If the question would have been कि अगर डॉक्टर ने क्या करना चाहिए कि आपका ऑब्स्टेट्रिशियन है and he seeing that the cord is coming out, then in that case we will do a vaginal examination to know the presentation कि how can, whether we can proceed for the delivery or not. So first thing is ask the patient to lie in Trendelenburg position without touching the cord. Okay, that is what the first thing we have to do. And of course the delivery needs to be done. Okay, especially when it is given that it's a term woman, so delivery needs to be done. What is the pattern of deceleration that you see with cord compression? What is the pattern of deceleration that we see with cord compression? चलो फटाफट फिनिश करते हैं. So you guys have your exam coming in next 5 days. INICET recall is important, and as you guys had asked for, I am planning to do tomorrow morning session में some pharmacology questions, the important ones, the previous AIIMS, or if I get hands on PGI and JIPMER as well, I'll try and do pharmac के rapid revision जैसे tomorrow. Okay. Okay, so in that case, yes, it is variable deceleration. Okay, remember that's your variable pattern of deceleration that we see in cord compression. Okay, that is what we see. So cord prolapse, it's a true obstetric emergency. So fetus compresses cord against the maternal pelvis, and it can also be cord spasm. So what complications can occur? There can be cord compression or there can be cord spasm. So basically decreased blood supply to the fetus. अगर डिलीवरी इमिनेंट है, दैट मीन्स द सर्विक्स इज डायलेटेड, यू कैन सी द हेड, द यूट्राइन कॉन्ट्रैक्शंस आर गुड, देन स्टार्ट पुशिंग एंड देन वी कैन यूज फोर्सेप्स और वेंटूस. इफ द डिलीवरी इज नॉट इमिनेंट, मतलब अभी आपका सर्विक्स डायलेटेड वगैरह नहीं है, so keep the cord in vagina but handle as little as possible. Push the fetal head up into the uterus so that the head does not compress on the cord, or adopt a knee chest position. We can also fill the bladder. जब आप bladder fill कर दोगे saline से, okay, we can use saline. Catheter डालो, bladder को fill करो. With the bladder का pressure, the head will go up, so that will prevent the cord compression. Immediate C-section might be required until the time the baby is delivered by the C-section. An assistant puts the hand in the vagina so that the cord is not compressed. Okay, cord compression nahi hona chahiye, so you have to place the head, and we can give terbutalin to minimize the contractions. If the delivery is not imminent, then terbutalin can be given. So knee chest position can be given, knee chest or Trendelenburg position. Next question, identify the position of fetal head in the image given below. What is the position of fetal head in the image given below? So this, look at the image very carefully. The image has been given as if you are looking at the patient from the front. आप ये front view से देख रहे हो, you are seeing the pubic symphysis. It is not पीछे sacrum. If it would have been the other way around, I'll tell you the answer will be different. Now, similarly to your radiology images, what is your left is basically your patient's right, and this is the patient's left side, right? This is the patient's right side. The patient is like this. This is the pelvis here. This is right side. This is left side. So you have the occiput on the right side, right? ये आपका midline है. Occiput is on the right side. तो left वाला option is out. Ruling out the options, number one trick to be used in your exams. Options rule out करो. You have high chances of getting the right answer. It is right occiput. Occiput is towards the pubic symphysis, anterior है. This is right occipito anterior. This is right occipito anterior. This is not left. अगर ये आपका उल्टा इमेज दिया हुआ होता, like let's say now I change this pelvis का image उल्टा. I show you the sacrum here and this is like the pelvis here. Okay, this is the pelvis here. Pubic symphysis आगे है. और बेबी का पोजीशन कंसिडर करो कि सेम है. दिस इज द पोजीशन ऑफ द बेबी. ओके, दिस इज द पोजीशन ऑफ द बेबी. Just that I am rotating the pelvis now. Then what do you think would have been the answer? Imagine like here you have the sacrum. Here you have the sacrum. In that case, what would have been the answer? I hope you got my question here. Are you sure it's gonna be left occipito anterior? Yes, correct. So Misbah, Anandita, very correct. In that case, then the answer will be left occipito posterior. क्योंकि आपका यहाँ sacrum है. So imagine you are looking at the patient from behind. Patient ऐसे खड़ा है, आप पीछे से देख रहे हो. So whatever is the patient's left is also your left, right? So if you are seeing the occiput on the left side from behind, that means it is left. It is towards the sacrum now. It is posteriorly towards the sacrum. So it is left occipito posterior. Okay, it is your left occipito posterior, right? So then this is your left occipito posterior. So I hope everyone is clear with this. Do not get confused. Look at the image कि आगे से image दिया है कि पीछे से image दिया है, right? They can also give you not the entire baby but just the fetal skull ka image. They can also give you just the fetal skull ka image. In that case, you should be able to identify which is occiput and which is your frontal. So your triangular one, where you have the triangular lambda वाला जो रहता है fontanelle, पीछे जो आपका fontanelle आता है posterior fontanelle, that is triangular one is posterior. The quadrilateral one, anterior fontanelle is your quadrilateral one. पोस्टीरियर फॉन्टेनल इज ट्राइंगल वाला. तो उस केस में देखना कि ट्राइंगल कौन से साइड में है. द ट्राइंगल इज व्हाट इज योर पोस्टीरियर फॉन्टेनल. ओके, नेक्स्ट वन, आइडेंटिफाई द ग्रिप. सो ग्रिप्स इज वेरी वेरी इंपॉर्टेंट. We have discussed this in one of the special classes as well on Unacademy. So पढ़ लेना ये topic, very important. Identify the grips. What do you think? Which grip is this? Right, so you see here the hands on either side lateral position में है, where you are checking कि यहाँ पे कौन से side में back है, कौन से side में limbs है, limb buds you will feel. That is your umbilical grip, which is your Leopold. Which grip? Is it the first, second or third grip? Which grip is it? Umbilical grip, yes, is also called as your lateral grip. It is your first, second, third, fourth. कौन सी grip होती है? That is your second grip. Okay, that's your second grip. So it's so it is very easy to remember this. Okay, it is very easy to remember. The first one, okay, the first one, that is your fundal grip. आप ऊपर से start करो grips. You are facing towards the patient's head. Okay, you are facing towards the patient head and you start from the fundus. So first you have the fundal grip, then you have the lateral or umbilical grip, and then you have the third one जो आप pelvis में आ रहे हो. The fourth one is the one which is you are turning towards the patient feet side now, towards the foot end, and your hands are coming like this. So this is what is your fourth maneuver, which is your second pelvic grip. Okay, that is your second pelvic grip. Third is your first pelvic grip. And the first one is the third Leopold grip is also called as Paulick's grip. Okay, this one is also called as Paulick's grip. So remember your first, second, third facing towards the patient head end. ऊपर से start करो fundus, then side में, and then नीचे pelvis में. Then you turn yourself, you go towards the patient's foot end and you look for this, that in the pelvis. So it is your fourth maneuver or the second pelvic grip. The first pelvic grip is called as your Paulick's grip. Alright. Next one. So you have a patient who is having recurrent trichomonas infection. She was advised pap smear. What should you explain to the patient? So I think the question here should be all of the following are true except. All of the following are true except. So yes, pap is a screening for cervical cancer. PAP can even show your trichomonas and it can also tell कि patient को cervix cancer है कि नहीं, but it cannot detect your all the reproductive tract cancer. So leave apart this question because it's based on recall, so there might be some ambiguity in the recall. But remember that your topic of STI, it's a favorite with your AIIMS examiners. Last INICET exam, we have seen many questions coming from the topic of STI. So make sure that in these last days you are revising the topic of STI. Gynac में से, Pharmac में से, Dermat में से. I have taken on Unacademy Plus platform पे STIs from dermatology, the various kits and what is the dose, what is the color of the kit. Very important. How do you differentiate one STI from other? It's extremely important, right? So ये वाला table quickly करते हैं. We have seen this before as well. So very important. What are the key points to diagnose कि whether it is bacterial, it is trichomonas or it is candida. Bacterial is your Gardnerella vaginalis. We have seen that Gardnerella vaginalis GV, it is gram variable Coccobacilli. So if they tell you gram variable Coccobacilli, it is your bacterial one. Okay. Now you have your, which is the, out of this, which is the one which does not have itching. So no itching is your bacterial vaginosis. Remember, there is no itching present in bacterial vaginosis. Bacterial and trichomonas both have pH more than 4.5. So that is where we can get confused. अगर आपको बोला कि pH more than 4.5 है, then look at whether there is itching or no. If there is itching, it is trichomonas. Okay, itching is present in trichomonas. Then so you can see that itching is present in trichomonas and candida. So you can write this as itching is present in trichomonas and candida. That is T and C have itching present. Bacterial में itching नहीं है. Your trichomonas classically has frothy green discharge. Look at the color. This one is thin yellow discharge bacterial. This is frothy green discharge. Strawberry cervix, important clue for your trichomonas. Strawberry cervix. यहाँ पे कोई inflammation नहीं होता है. Both of them can have positive whiff test. Again a similar point. Here in wet mount we will see clue cells. That means on the epithelial cells you will see the appearance like this. And here you will see the motile trichomonads. For both of them, the treatment is metronidazole. But since your trichomonas is a sexually transmitted condition, it will need the treatment of the partner as well. Okay, it will need the treatment of partner as well. So remember here in bacterial vaginosis, we can give metro or clinda. Here we give metro and we need to treat the partner as well. Very, very important. So next time you can get the question, all of the following are true about this except like let's say pH less than 4.5. No, it is pH more than 4.5. Itching is present, frothy green discharge, whiff test can be positive, partner also needs to be treated, and you will see the motile trichomonas pear shaped is what we will see, and metronidazole is the drug. Now if after treatment of the patient and the partner generally trichomonas does not recur, if it is recurring, that means there are other associated probably STIs as well, and or the patient has multiple sex partners. So then we need to evaluate for that. So when the patient has recurrent trichomonas, then the pap smear also becomes important. Associated STIs like your HPV, which can cause your CA cervix as well. So we need to evaluate for that as well. Okay, we need to evaluate for that as well. So remember, trichomonas is your STI. Trichomonas is sexually transmitted. It has your strawberry cervix. Okay, it has your strawberry cervix. So trichomonas you can remember as trichomonas is the one which has your strawberry cervix. Okay, trichomonas has your strawberry cervix and it is sexually transmitted. Okay, and it is sexually transmitted. Next one, look at these some images, very important. Image A, B, C, D and E. What do you think is the diagnosis? These are very, very important images that can come in your exam. What is the first one? What is the diagnosis in the first one? A is Candida, right? Because the classical appearance that you see here like this is called as your shish kebab appearance. This is your shish kebab appearance, which is seen with Candida. Okay, it is seen with Candida. So imagine you can remember this as like you went out and you had shish kebab and you had candy. So shish kebab khane ka or candy khane ka, they both go together. So remember, shish kebab is Candida. What is the second one? Image B here. Anyone, what is the B? B is not bacterial vaginosis. B is not bacterial vaginosis. B is not clue cell. Clue cell is this one, image E, where on the epithelial cell you see this attached one. These are the clue cell. Okay, so remember B and C, they go together, A, B, C. Bacterial vaginosis has clue cell. Okay, bacterial vaginosis has clue cell. This is the epithelial cell. This is the organism here. When you see this organism is so huge, itna bada hai, epithelial cell se bhi bada, then this is your actinomyces. Okay, remember that actinomyces will be large, as the term also is large. Actinomyces is bigger than the epithelial cell. So remember, this is actinomyces. This also is your actinomyces, which is giving the cotton ball appearance, So remember, actinomyces, you have the cotton hidden in it. So cotton ball appearance is seen with actinomyces. Very, very important. And this is straightforward. your pear-shaped single nucleus, this is going to be your trichomonas. Okay, this is going to be trichomonas. This topic is very, very, very important, and we do expect one question from this in your exam. It's extremely important. Okay, so this is your clue cell, bacterial vaginosis, Gardnerella. Okay, so shish kebab and candy. Actino is cotton. Actinomyces is bada word. It is larger than the epithelial cell. All right. Next one. All are true about breech delivery. I think this is the easiest of all. All of the following are true about breech delivery except so I think this is very, very practical. I mean, you don't even need to study this to get the answer right. So breech identified for the first time during delivery is a contraindication for normal labor. It is not so. It is ऐसा नहीं है कि हर बार breech का cesarean ही करना पड़ेगा. We cannot do normal. It's absolutely not like that. Breech delivery of course has more high risk as compared to your cephalic presentation. So continuous FHR monitoring is done because in breech the last part that comes out is the head of the baby. If that gets stuck, there can be complications. All this, it requires continuous FHR monitoring. If the head is stuck, we need a facility for emergency cesarean section. Then only we should do your breech delivery. And it should be undertaken at a center where the birth attendant skilled in breech delivery is available. Basically, the question is telling you that you need increased skill for breech delivery. Doing a normal delivery in breech requires more skill. So the answer is A, right? Next one, HPV protein in vaccine. जो आपका HPV vaccine है, उसमें कौन सा protein होता है? E6, E7, L1 capsid or E1, E2 or all of the following? HPV protein in vaccine is so again, vaccines is something which is a very, very favorite topic with your examiners. Especially now, आपका COVID vaccine is something that you should definitely prepare very well. You should expect one question on COVID vaccine in your exam. It's very, very important. That is your L1 capsid. Okay, that is your L1 capsid. So your HPV protein basically has your capsid protein, which is your L1 protein होता है. L2 protein होता है. This is the one which is responsible for attachment to the cell and for entry into the cell. Okay, so this is responsible for attachment, your L1 and L2. L1 बड़ा बड़ा है. So what do we do is we just take this L1 capsid protein और उसका हम बनाते हैं वैक्सीन में. So this looks like a virus, but it does not have the DNA. It does not have the nuclear material to replicate. So it is not infective. So this is called as virus-like particle. It looks like a virus, but actually it's not a virus. This will attach to the cell. The vaccine में L1 capsid will attach to the cell. It will induce the immunity in the patient. तो infection नहीं हो रहा है, cancer नहीं हो रहा है because it is only L1 capsid protein. Your E1 and E2 proteins are the one which are responsible for integration of your viral DNA with the host cell. These are responsible for integration. E6 and E7 which are your onco-wale proteins which induce the cancer. How do they induce the cancer? E6 and E7 by knocking out your tumor suppressor genes. Which tumor suppressor genes? P53 and your retinoblastoma, RB gene. Both of these are tumor suppressor. उनको निकाल दोगे तो tumor बनेगा. So E6 and E7 which are responsible for causing the cancer. P53 E6 and E7 RB. Okay, that is what is your HPV vaccine. So COVID vaccine जरूर पढ़ के जाना for your exam. Very, very important. Your Gardasil is quadrivalent, Cervarix is bivalent, and अभी हमारे पास 9 वाला भी है जो हम यूज कर सकते हैं वैक्सीन. Quadrivalent में कौन सा है? 6, 11, 16, 18 and bivalent is only 16 and 18. Okay, bivalent is only 16 and 18. Next one, pregnant woman has cramps at night. What will the nurse tell the patient to do? So very common cramps at night are common, especially in pregnancy. What should the patient be advised? Plantar flexion of ankle or dorsiflexion and knee flexion or knee extension. क्या करना चाहिए? So whenever there are cramps, first thing is stretch the leg. Okay, to stretch the leg, let me show you the image. शायद नहीं है. So सबसे पहले leg stretch करना है, मतलब knee extension करना है. Now in your cramps में जब आपके leg में cramps आते हैं, most common affected are your calf muscles. ठीक है, calf muscles contract हो रहे हैं. When the calf muscles are getting contracted, so then we get your plantar flexion. So to relieve that, we ask the patient to do dorsiflexion. क्योंकि calf muscles में cramps बहुत common है, plantar flexion हो रहा है. So ask the patient to take the toes towards the shin. That means do dorsiflexion. First stretch the leg, that is do knee extension and do dorsiflexion. It is not plantar flexion क्योंकि already आपका calf muscle contraction की वजह से plantar flexion हो रहा है. Okay, already it is causing plantar flexion. So do dorsiflexion, stretch the leg, that is your knee extension. So this is very important. Why do we get your cramps? Hypocalcemia, magnesium कम हो सकता है, there is increased lactic acid during pregnancy. So we can ask the patient to take magnesium, ask the patient to do some massage whenever there are cramps. These are some of the points that can be done. All right. नेक्स्ट वाला पार्टोग्राम. सो ये वाला टॉपिक है जो मैं डिटेल में कवर करने वाली हूँ टुडे इन द 5 PM सेशन, because we have seen that every exam has at least like one question on partogram. We will cover partogram, we will see the various type of your labor curves. How do you identify the curves? ये prolonged latent phase है, ये आपका active arrest है, आपका protracted active phase है. All of this we will see the curves as well. So graphs, my favorite, one of the favorite graphs, वो हम देखेंगे. So yes, in your modified WHO partogram जो हम अभी यूज करते हैं, the cervical dilatation starts at 4 centimeters. The cervical dilatation starts at 4 centimeters. It does not have a latent phase. The modified one does not have a latent phase. Now you have the alert line, you have the action line. Detail में आज discuss करेंगे at 5 o'clock. What is the gap between your alert line and action line? How much is the duration gap between alert line and action line? कितने hours का फर्क होता है? It is 4 hours. Okay, it is a gap of 4 hours between alert and action. And where do you know, the patient has come in labor, right? आपका patient आया labor में, आप 4 centimeter cervical dilatation पे partogram पे start करोगे. कहाँ mark करते हो first वाला? Where do you mark the first reading? Is it to the left of the alert line, on the alert line, to the right of the alert line, on the action line? Where do you mark the first reading? When the patient has come, cervix dilated है 4 centimeters, आपको mark करना है. कहाँ mark करोगे first one? On alert line. Okay, so remember that the first reading is marked on the alert line. The first reading is marked on the alert line, and then on the progress we see whether the progress is going to the left of the alert line or to the right of the alert line. So the first is done on the alert line. The first reading is done on the alert line. All right. And किसी ने 6 centimeter बोला answer. 6 centimeter is what is your definition, clinical definition of your when the active dilatation जो बोलते हैं active phase of labor, that starts at 6 centimeters. But WHO has not modified it yet. It is your 4 centimeters जहां हम start करते हैं आपका partogram. If आपका question है कि active phase कब start होता है, it is more than or equal to 6 centimeter dilatation. But partogram में it is still 4 centimeters. And what is the minimum dilatation speed according to WHO? Irrespective whether it's nulliparous or multiparous. So according to WHO, the minimum is the minimum is 1 centimeters per hour. Okay, the minimum is 1 centimeters per hour. That is what should be the dilatation. Okay, so detail में partogram cover करेंगे. I'll show you the curves as well. The questions that have been asked previously, I'll show you that as well. Okay. So this is what is your alert line, action line. ये हम डिटेल में करने वाले हैं. 1 big square, small square, आपका 4 centimeters and everything will be covered today. तो हो गया, खत्म हो गया यार. यही था, इतने ही क्वेश्चन थे आपके INICET ObGY में. बट इसका मतलब ये नहीं है कि इस बार भी कम क्वेश्चंस आएंगे. ObGY इज वेरी 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 इंपॉर्टेंट, ओके, फॉर योर एग्जाम. So 5 p.m. आपका what is the definition of prolonged latent phase in a nulliparous, multipara? How will you remember that कि second phase कब बोलते हैं? आपका protracted, arrest. What will you do in protracted? What will you do in arrest? वो सब we will see today. You can expect one question on that topic for sure at 5 o'clock. Okay, so this was a quick revision of your ObGY recall, and as I told you guys, tomorrow we will have the sessions on our YouTube channel. I think it's also difficult for me morning में early morning session रखने के लिए. So we will have sessions at 12 p.m. I hope this is fine with everyone. I hope this is fine with everyone. If we have sessions at 12 p.m, then we will have at 5 p.m, and then we will have at 10 p.m. So the thing is, जो quiz हमारा 12 बजे था, okay, no, these were all 3 years नहीं, ये सिर्फ INICET 2020 के PYQs थे. इतने कम questions नहीं रहेंगे 3 साल के. तो I think फिर जो हमारा quiz time है, quiz time हमको shift करना पड़ेगा. So we will shift the quiz time then to your 11 a.m. ठीक है, तो क्विज को 11 कर देंगे और आपका मॉर्निंग यूट्यूब सेशन एक्चुअली 12 o'clock हो जाएगा. 5 p.m, 10 p.m और 12 बजे रहेगा हमारा study with me session, where actually I'll be sitting and studying and preparing for all these sessions. Okay, so thank you so much everyone for joining in. I have taken your 5 subjects INICET recall, free class है, please देख लेना अनअकैडमी पे. फार्मैक मैंने ऑलरेडी वहाँ लिया हुआ है INICET का. फार्मैक हुआ है, फिजियो हुआ है, माइक्रो हुआ था, पैथो हुआ था. So these were some of the subjects that we had discussed. I think you can definitely check it out. All right. So thank you and goodbye. Take care. Keep studying.